Welcome back to Silent Medicine, where science meets spirit, and where healing is allowed to be kind, honest, and embodied. I am Dr. Nnenna Ndika, clinical psychologist, integrative medicine doctor, and someone who has had to unlearn a lot about what movement is supposed to look like in order to stay in relationship with her body. Today, I want to talk about movement, and more specifically, about movement that supports your body, rather than silently betraying it. I want to tell you the moment I realized movement can become betrayal. There was a time I treated workouts like an obligation, without really listening to my body. Sometimes I worked out when I was tired, even when my body felt inflamed and achy. Other times I forced myself to work out when I knew my sleep wasn't solid the night before. And I remember finishing one workout and thinking, why do I feel worse after something that's supposed to help me? Not tired in a good way, but tight, braced, almost irritated in my body. That moment started a new question for me. What if the goal isn't to push harder, but to move in a way that rebuilds trust between my nervous system and my body? That question is one of the roots of why I incorporate physical and functional movement into the MBRM coaching program. Because trust is part of healing. You see, many of us learned movement through a very narrow lens. We learned movement was something you did to burn calories, push through discomfort, fix what was wrong, override signals, and rest. Even the language we use tells the story. We use phrases like, no pain, no gain, push harder, don't be lazy, finish strong. For some bodies, at certain stages of life, that approach may appear to work, at least for a while. But for many people, especially sensitive systems, it comes with a cost. I've worked with countless individuals who didn't stop moving because they were lazy or unmotivated. They stopped because their bodies no longer trusted the relationship. Whenever they worked out, pain increased, fatigue deepened, injuries appeared, motivation disappeared. And somewhere underneath all that was a quiet realization. Every time I move the way I'm told I should, I feel worse, not better. My friend, let me tell you this. That's not failure. That's innate wisdom trying to get your attention. Speaking through sensation, intuition, and the body itself. Movement at its core is not punishment, it's communication. It's also a way of staying in appropriate motion, a living mechanism that supports freshness and helps prevent stagnation. When we move, especially with intention, the body receives signals and begins asking, is this safe? Am I being listened to? Will I be pushed past my limits or met where I am? When movement consistently violates these questions, the nervous system responds with resistance, tension, and shutdown. Movement becomes another stressor instead of a support. In the same way, movement layered on top of poor or insufficient sleep becomes a stressor for the nervous system, for the body as a whole, and for those more delicate aspects of our being. Movement is most helpful and supportive, not when we ask, how do we push harder? But when we ask, how do we help the nervous system feel safe enough to move? Because without safety, there's no sustainable strength. And without trust, the body will eventually refuse to cooperate. It's a bit like working with animals. A horse has to trust its trainer and the relationship between them. If the horse is resistant, a good trainer loosens the reins, gives more space, and allows the animal to feel safe enough to try again. Over time, as safety and trust build, cooperation becomes possible, even natural. Movement that doesn't betray your body begins with state, not intensity. If your body is braced, exhausted, inflamed, or overwhelmed, asking it to perform as if it's resourced and rested is not discipline, it's disconnection. In my mind, it's even disrespectful. In those tense states, the most intelligent movement might look very simple. Slower, gentler, more grounded, more consistent. Not because you're weak, but because your system is asking for respite and space to recalibrate. One of the biggest shifts people experience when they move this way is relief. Relief that they don't have to fight themselves anymore. Relief that movement can feel supportive instead of punishing or obligatory. Relief that progress doesn't have to come with dread. And often, once that relief settles in, strength actually begins to return. Have you noticed that? Not forced, not rushed, but rebuilt from a place of truth, honesty, and safety outward. I also want to speak to age here because it matters. Many people in their 40s, 50s, and beyond are told, directly or indirectly, that decline is inevitable, that pain is just normal, that stiffness is a price of time, that injury is something you just deal with. But often, what's really happening is that people are being asked to move in ways that no longer match their current physiology, stress load, or recovery capacity. When you adjust the approach, not just the exercise, the body often responds with surprising generosity. Honestly, I often ask myself out loud, why is growing older treated as synonymous with infirmity? And each time this question arises for me, my conclusion is the same. It's not true, but that is one of the biggest lies of our time. Think of a 1920s vintage automobile. It may look older or no longer in fashion, but in the hands of a devoted owner, it's cared for over time and it still functions beautifully. Smooth ride, no squeaky protest, a joy to have around. An older body is similar. It needs the appropriate approach and the right kind of movement. The same is true for bodies that have injured and have had to adapt. We may need to modify how we move, but we don't have to give up on movement itself. After all, movement is lotion for the joints and for the soul. Movement that respects your body listens to signals. It listens to your breath. Does it stay accessible? To your posture? Does it feel supported or strained? To your energy? Do you feel steadier afterwards or depleted? And recovery? Does your body settle or tighten afterward? These are not inconveniences. These are feedback, also can be called data. When you listen to that feedback, movement becomes a dialogue, not a demand. I want to gently bring up something difficult here. For many people, moving differently can feel like grief. Grief for the body you once had. Grief for how effortless movement used to feel. Grief for identities built around pushing, endurance, or toughness. And sometimes there's shame and even guilt, especially if you were once athletic, disciplined, or known as the strong one. But there's nothing to be shameful about adapting. There is nothing shameful about adjusting. Adaptation is not defeat. It's intelligence in action. What did I just say? Adapting to a situation is not a failure. It is embodied wisdom. Movement that doesn't betray your body is not about doing less forever. It's about rebuilding trust first. Remember the horse story? You give time and space for the horse to trust the relationship with the trainer. In the same way, you give your nervous system and your body time and space to rebuild themselves gently from the inside out. When the body trusts that movement will not harm it, it becomes far more willing to participate. Strength that comes from trust lasts longer than strength that comes from force. Just like respect and cooperation that grows from love and trust run deeper than obedience that comes from fear or aggression. As you move through this week, I invite you to gently reflect on this. When you think about movement in your life right now, does your body feel understood, betrayed, or managed? And what might change if your next movement choice came from listening instead of obligation? Thank you for spending this quiet time with me today. If something in this episode touched a nerve in a good way, or helped you feel less confused, overwhelmed by it all, you might share it with someone whose body has also been carrying a lot in silence. You can find more calm, practical reflections at silentmedicine.com. And if you'd like gentle support about once a week, you're welcome to join the Silent Medicine newsletter there as well. As usual, a gentle reminder before we close. This podcast is educational only. It isn't medical or psychological advice, and it doesn't replace working with qualified professionals who know you and your history. So, if you're working with injury, chronic illness, or significant pain, please seek care from qualified professionals who can support you safely. Until next time, may you notice one quiet way your body is already taking care of you, even if the world hasn't honored that yet. And may you keep listening to the healer within. Again, thank you for being here. Thank you for honoring your body's signals. I am Dr. Nnenna, and this is Silent Medicine. I'll see you in the next episode. Take care.